Hello everyone, I am Taru, a master's research student at IIIT Bangalore in India. I'll be presenting the paper Platforming PCOS Treatment Online, FemTech Logics of Care, co-authored by me and Preeti Mudliar, who's also my supervisor for this research. In this work, we study the emergence and operations of FemTech, short for female health-oriented technologies in India. While the struggles ensuring provision of adequate attention to women's unique healthcare needs dates to the establishment of the field of gynecology in the 19th century, recently the digitization of healthcare products and services for individuals assigned female at birth or AFAB has gained prominence. This has led to a notable surge of the femtech market, targeting these individuals' unmet healthcare needs globally as well as in India. Though the Indian femtech market is targeting various health concerns of AFAB individuals, ranging from breast cancer detection to fertility linked counseling, our focus in this study is on platforms providing health packages for managing polycystic ovary syndrome, given the popularity of such platforms over the past 3 to 4 years. Polycystic ovary syndrome, or PCOS, is a chronic and enigmatic reproductive health concern resulting in symptoms such as sudden weight gain, thick facial hair growth, irregular menstrual cycles, and subfertility. The presence of these symptoms in AFAB individuals' bodies is highly stigmatized given the challenge the normative beauty standards and reproductive trajectories for these individuals. PCOS requires lifelong management by adhering to lifestyle changes that are considered healthy and requires attention from multiple health experts, including gynecologists, nutritionists, and dermatologists. Due to the stigma around PCOS, its management is directed towards weight loss, skin care, and fertility restoration. As one of our interviewed participants mentioned, I have experienced medical gaslighting multiple times and been recommended pads to resolve PCOS. A gynecologist lost interest in my PCOS case when she realized I was not pregnant and not planning for it either. Interestingly, we found that many Indian femtech platforms describe their approach towards PCOS management as care by highlighting it in their taglines and in the ways they describe their teams and health packages. In doing so, they also claim that a care-driven approach for PCOS management is absent in offline health infrastructures like hospitals, where the doctors are often overburdened to engage patients for long term and where health conditions like PCOS are stigmatized. As the femtech market claims an enhanced approach towards PCOS management as compared to that in offline infrastructures, we sought to understand what care means and how it attains a market value when traditionally care work has been devalued. We draw from Anne-Marie Mode's work on the logic of care, wherein she located the practice of care between patients and doctors who collaborate continuously to manage chronic conditions like diabetes, as opposed to markets who disengage with its customers after selling a product and therefore fail to deliver care. Thus, we probe on a femtech logic of care, given care's insistent centering by these platforms. More specifically, as we contrast the offline and online care for PCOS, we focus on two key research questions. First, we interrogate how PCOS care gets interpreted and implemented in offline gynecological infrastructures in India. Similarly, we study how PCOS care gets interpreted and implemented in femtech platforms in India. By interrogating these questions, we contribute to the CHI and CSCW research discourse on women's health and future of care work in multiple ways. First, we demonstrate how digital startups reconfigure the offline conditions for PCOS management, characterized by a fragmented, discontinuous, and biased experience, into digital care, which is collaborative, iterative, and non-judgmental. Second, we identify the promises and pitfalls for the femtech platform's claims of serving as digital alternatives to offline gynecological infrastructures. Finally, drawing on our analysis of the femtech logic of care, we offer recommendation for femtech founders and offline medical bodies to design sustainable and inclusive offline and online health systems for AFAB individuals. We conducted an ethnographic research study in Bangalore and online over a period of 18 months to understand the conditions for PCOS management in offline health infrastructure and femtech platforms. To explore the offline infrastructural conditions for PCOS caregiving and receiving, we interviewed 11 gynecologists working across various public and private hospitals and clinics in Bangalore, and 17 patients with PCOS and fertility concerns who had consulted with offline gynecologists. None of these gynecologists or patients were associated with any femtech platform. We also observed the interiors of the gynecology waiting area, the OPD timings, and the waiting times of patients across 14 hospitals and clinics. Similarly, to understand the motivations and practices of centering and delivering care by platforms, we studied 6 of them. We interviewed 6 platform founders, 19 platform customers with PCOS concerns, and 2 gynecologists who were practicing at the platforms. We also interviewed 4 care managers, which is an emerging role in these platforms undertaken by women employees. We interviewed 60 participants in total across these categories of multiple stakeholders shaping offline and online health systems. We'll now discuss our key findings, starting with the offline conditions of PCOS care. We noted that the prominent focus of gynecology specialty was on pregnancy and childbirth, while the public hospital gynecologists explained their focus towards pregnancy as attempts to manage maternal mortality rates. The monthly revenue targets linked to successful deliveries skewed the attention towards pregnancy and fertility in private hospitals. The interiors of various hospitals too displayed information and paintings linked to pregnant women and heterosexual couples with their newborns. One of the hospitals we visited had a gynecology specialty housed in a separate building with the word "ma," which translates to mother, in its name. A gynecologist in a public hospital mentioned, "We are a developing country, so the focus is on lowering maternal mortality rates. We are overwhelmed in ensuring this itself. Once this is done and economy improves, then we can focus on quality care and ensuring and supporting women through other menstrual health phases." Consequently, the focus on biological fertility affected gynecological attention to PCOS, wherein they felt disinterested or unequipped to support PCOS patients until fertility treatment was required. Moreover, we found that lack of time and support between different health experts hindered the continuity in offline PCOS care. The number of patients in private and public hospitals often exceeded 30 and 100 respectively. As shown in the images on this slide, especially in public hospitals, due to the high workload, gynecologists often consulted several patients together, and patients had to wait for as long as 8 hours for their consultations. As gynecologists were unable to provide personalized advice to PCOS patients, they often discontinued receiving treatment by not returning for follow-up consultations. For instance, a gynecologist described his time constraints and approach to patient consultations as, "We are frustrated with our workload due to the number of patients and are just looking to finish the consultations. These patients are poor and are not in a position to protest about privacy and infrastructure." As a result of these constraints, patients felt neglected and engaged with trial and error approaches focused mainly on losing weight. We'll now describe how the FemTech platforms employ care to identify and respond to such discontinuities in offline PCOS management. While gynecologists employed their medical expertise to address PCOS concerns, its management on platforms was shaped by personal experiences and business acumen of platform founders. As digital startups backed by venture capital funding, platforms could conduct user research and market research to understand the scope of digitizing PCOS management. For instance, a founder who was motivated to build a platform based on their own neglectful experiences with offline gynecological infrastructures said, "Non-dismissive gynecologists and comfortable infrastructure is basic healthcare that someone well-educated like me should not struggle to access. I can easily afford to pay 1,000 INR or $12 extra for these. We spend so much for an experience at Starbucks and Zara, but where do we go for a premium quality healthcare experience?" Similarly, another founder who conducted interviews with patients and healthcare experts to understand challenges in offline PCOS care delivery and reception highlighted that her platform introduced a PCOS package because they received multiple queries from women regarding PCOS symptoms owing to inconsistent diagnosis practices for the condition in India. Founders concluded that offline PCOS care systems are broken and believed that a digital platform could facilitate long-term coordination between health experts and women. The market and user research conducted by platform founders motivated them to label their approach to PCOS management as care. Founders opined that as opposed to short-term treatments focused solely on regulating menstrual cycles that are offered in existing health infrastructures, the platforms provide long-term support for different PCOS symptoms and clarity over non-reversible nature of PCOS, which counted as care. Accordingly, founders strategically employ the word care in their taglines to gain investor trust and ensure continued funding, which was integral for platforms to sustain their business model of offering long-term plans for PCOS. As one founder described, delivering care to manage PCOS symptoms is an important indicator of our scalability. Similarly, care was also used by platforms to assure customers that the platform would provide them with an uninterrupted PCOS management experience, supporting them in building lifestyle habits. As one care manager said, "Using the term care is a wordplay. It's a fancy, acceptable, and comforting word that FemTechs use to sound." Platforms' clinical supervisors use data from the user research conducted by platform employees to sensitize gynecologists towards an unbiased consultation style that is not centered on fertility and childbirth. Gynecologists of fund platforms were also trained to ask the customer their pronouns before starting the consultations. A female founder described her platform's approach to training gynecologists by saying, we train gynecologists by showing them our research data, such as Instagram polls where women share their judgmental gynecological interactions. A clinical supervisor uses this data to train our gynecologists on taking detailed medical history and avoiding biased questions around marriage and fertility. Platform gynecologists are accordingly evaluated based on customer satisfaction with the time, nature of interaction, and medical advice provided by them. Customers we interviewed share that platforms ensure allocation of sufficient time for their interaction with gynecologists, making them feel heard. Given the enigmatic nature of PCOS, access to different health experts and tracking engagements with them is crucial to ensure improvement across various symptoms. Therefore, platforms provided customers with different experts, including nutritionists and fitness trainers, who customize the care plan to individual needs. At the center of this care model of platforms were the care managers who were also serving as operations manager or nutritionists. They coordinated the care plan between these experts and customers and engaged customers with regular follow-ups to ensure adherence to the care plan. A care manager described the necessity for such customer engagement by saying, this role is like nursing women to health. We handhold them throughout since it's easy to feel demotivated in an online mode, especially for PCOS, which requires long-term commitment. Customers also share their experiences of interacting with care managers who iterate on their health goals and motivate them to develop lifestyle habits even during phases of slow progress. Analyzing our findings using Anne-Marie Moore's logic of care, we found that platforms provide a collaborative, continuous, and an iterative experience for PCOS management, which are key characteristics of a care process. Therefore, platforms succeed in providing PCOS care to an extent by reconfiguring the time, consultation style, and human infrastructures like care managers who iterate on customers' health goals and relieve them from being solely responsible for their PCOS management. However, funding criteria such as revenue targets, which is set by the venture capitalist funding the platforms, the limitations of scaling human infrastructures like the care managers, and the passive forms of acquiring queer customers raise questions on the sustainability and inclusivity of platforms. Identifying these merits and vulnerabilities of platforms as care infrastructure, we offer the following recommendations. Unlike offline infrastructures, FemTech platforms lack physical permanency and are often less accountable to customers, stopping their operations in absence of investor funding. Therefore, platforms may benefit from collaborating with medical bodies like the Indian Medical Association, which aims to promote improvement in public health in India. Such bodies can recommend guidelines to ensure patient protection and prevent disruption in PCOS management in cases of low investor funding. Platforms could also lobby for insurance coverage of their services as they may discontinue offering discounts to customers once they scale up, which could lead to a substantial out-of-pocket expenditure for the customers. Customers can highlight their positive interactions with care managers in their testimonials, which may encourage investors to ensure adequate compensation for them, as currently care managers are compensated mainly for their roles as nutritionist or operations manager. Platforms may also collaborate with NGOs focused on queer, sexual, and reproductive healthcare to initiate more inclusive care protocols for them. We also recommend that healthcare association like the Federation of Obstetrics and Gynecological Societies of India may collaborate with platforms to integrate sensitization modules in the gynecology curriculum and advise practicing gynecologists to shift the focus from marriage and fertility to a more holistic and long-term based health approach in their interactions with the patients. Hospitals may also benefit from employing roles similar to a care manager to minimize the responsibilities of gynecologists to medical opinions. And yes, thank you for engaging with our work. In case you wish to discuss more about this research, we would love to hear from you.